Thanks a lot for joining us here on KC2. This is a Purpose Rwanda show for a purposeful and addiction-free Rwanda. I am Lavi Mutanganchuru. Today, we are going to discuss the essence of mental health awareness in fighting drug abuse. And joining me today is Dr. Arthur Rukundo. Thanks a lot for joining us today, Dr. Arthur.
Thank you.
He's a psychiatrist by profession since the year 2006, and he currently works at Ndera Neuropsychiatric Hospital, among other health facilities where he serves. And Arthur, as you've just heard, we're going to discuss the essence of mental health awareness in fighting drug abuse, or the importance of mental health awareness in fighting drug abuse. And as we begin, maybe in layman's language, or in the language that everyone can understand, how do you explain mental health?
Yeah, thank you, Lavi, for inviting me here at KC2. I don't know if I have to explain it according to your question, but let's try to define first of all health.
Yes.
Because we can't talk about mental health without talking about health.
Yes.
So health is a state of well-being, physical well-being, mental well-being, and social well-being.
Yes.
So here I emphasize on 3 points: mental well-being, physical well-being, and social well-being. Now, when it's about mental health, then I think it is a time when we go up.
Yes.
We go up in a function of the whole body.
Yes.
Because mental health is concern the brain.
Yes.
It concerns the brain, and in the brain there is brain functions.
Yes.
So the brain itself can be affected, but also functions of the brain can also be affected. And that is why now mental health is also well-being psychologically, emotionally, and even in organization, judgment, all functions of the brain.
Yes.
Yeah, so before we continue, I think I have something to say to the public, is that mental health is very important.
Yes.
Mental health, we say no health without mental health.
Yes, definitely.
Yeah, so it means when you are good mentally, other things can follow.
Yeah, that's it.
But when you are not
mentally healthy,
you can present what we call mental disorder.
Yes.
Or mental health problems.
Yes, thanks a lot for bringing that up. It's actually the next question that I was about to ask: mental health disorders or mental disorders. What are the prevalent, like based on your experience, you've been a psychiatrist for quite a decade and a half, more than 15 years you're a psychiatrist.
Yeah.
And
16 years.
Yes, 16 years. Yes, yeah. It's more than 1 decade and a half. And what do you think are the prevalent or the most common mental health disorders that we have here in Rwanda? Like the mental health disorders that we have in Rwanda that are most common countrywide?
Okay, thank you for the question. As you say, according to my experience, I have started to work in the domain of psychiatry in 2006.
Yes.
That was in Ndera Neuropsychiatric Hospital.
Yes.
And now it's like 16 years of experience in that domain.
Yes.
The prevalence, the most frequent mental health disorders is what we call brief psychotic disorder.
Yes.
And others we have also, which is an acute condition.
Maybe you can explain more on that first, mental disorder, for people like to get to know what this really is.
Yeah. Brief psychotic disorder is a mental health condition we see this condition around 16, 17, or 18 years old patients. And it can occur after a trauma.
Yes.
If it can occur after experiencing a serious problem
Yes.
in life, separation of parents,
Yes.
or death of a member of a family member,
Yes.
or use of drugs. You know that actually there is drug abuse in our society,
Yes.
and those are many causes. Those are the causes that can
lead to this
these mental health disorders. Yeah.
And what are its symptoms? This one specifically, what are the symptoms of this mental health disorder?
Yeah, the main symptoms are what we call delusions.
Yes.
And hallucinations. That's the main symptoms. And if a patient presents these two symptoms, he can also present agitation, because when he has or she has hallucinations,
Yes.
he cannot be calm. He'll be agitated.
Yes.
He will have bad sleep. He will have he'll present problem in his behavior.
Yes.
He
Behavior
can be
change.
behavior change. He can be aggressive. Can be aggressive, and this he can be aggressive physically, or he can be aggressive verbally.
Yes.
Yeah, I think that's the main symptom. So it's hallucinations.
Yes.
What we call delusions, which is it's a belief, false beliefs of the patient, and sleep disorders, agitation, and aggressivity.
Okay,
Yeah.
I see.
And this can occur abruptly during 1 week, just 1 week, and you see changes to the patient.
Okay. Does it continue for like a long period of time, or it comes a week, it goes away, it comes back, it goes away?
No, it continues. When it occurs, it continues, and something which is strange is that the patient cannot recognize that he's behaving abnormally.
Yes, abnormally.
Yeah, that is where members of families are encouraged to bring the patient to the hospital.
Yes.
Yeah, and we know, according to beliefs or lack of information about mental health.
And ignorance, of course.
Yeah, people, they don't come first in a hospital.
Yes.
Because mental health problems, people can think that
You're crazy.
Yeah, you have faced bad people, you have been attacked by demons. So they start to go to churches and other people, but finally they come to the hospital to seek for treatment.
Yes.
And when they arrive to the hospital, we take care of the patient, and after a month he can be okay.
Yes.
Can be good, and he can continue the treatment ambulatory.
Yes. Okay. Thanks a lot for bringing that up. And I think it also has to do. It depends on the level of that disorder itself. That's what determines whether you'll give him or her a 1 month treatment, 2 months, 3 months, and so on. Now, the next question that I want to ask you is, now that we know the prevalent mental health disorder in Rwanda that is most prevalent among people who has these issues, then what is the leading cause of these mental health? Not necessarily talking about the one that is prevalent, but generally speaking, what is the leading cause of mental health disorders in Rwanda?
Thank you for the question. I think generally, and it is not only in Rwanda,
yes.
It's in the world.
Yes.
It's in the world. We categorized these causes in 3 parts.
Yes.
There is biological causes, there is psychological causes, and there is social causes. So in biological causes, I can give you an example of chronic condition.
Yes.
Such as cancer, such as diabetes, such as high blood pressure.
These incurable diseases.
These incurable disease.
Yes.
So these incurable disease affect the brain.
Oh, really?
It affects the brain because it puts someone in a condition that he sees that
Life is about to end.
life, the end of the life, yeah. So it affects
Their mental health.
The mental health, and the main disorder we see in this condition is depression.
Depression, yes.
Is depression or changes of mood.
Yes. Mood disorder.
Mood disorder, yes. So the second cause is mostly psychological. And when we talk about psychological, we think about the development. And when it's development, it's about this development. We don't think when at birth.
Yes.
Even before birth.
Yes.
And, during pregnancy.
Yes.
So during pregnancy, someone can experience stress.
Yes.
You know that?
No, I didn't know. I mean, I'm just also learning, just like
So
the people that are following us, yes.
after birth, during from
pregnancy. And if you can highlight more on the pregnancy, like during pregnancy, how can one experience like stress? He's not even yet born. He's not even 1 year old. Like, how do they experience? How does a baby in the mother's womb experience stress or any mental health disorder?
Yeah, he or she can experience stress or fear before birth, because let me tell you that the brain functions, especially the mood, starts at the second trimester of the pregnancy. Means at fourth month. Yeah. So why? Because the fetus is in communication or is in interaction with his mom.
Yes. Yes.
See?
Yes.
So here, if during pregnancy, the woman is stressed, have fear every day, that fear can be transferred to
the baby,
or to the fetus. Yes.
I see.
Then after birth, there is other phases of development. You know, childhood. And during the first and second year or the third year, the baby is mostly in communication or interaction with his mom.
Yes.
And that part of life is very, very important, because if there is a bad interactions, it can affect him or her for the rest of the life.
Yes,
and after that, there is 5, 6, 6 years, so it's another stage of development.
Yes.
Yeah, and during development, that is where someone can present what we call personality disorder, or can develop personality disorder.
Yes. Yes.
So that's the part of psychological. And the third one is the social now. You know, social problems. Social problems can, can be causes. And I think it's the most part. It is the most part, our social interactions during our development, the problems we face, so when we can't cope with, stress and pressure in a
workplace.
So in workplace or in schools, someone, a young boy or a young girl can face stress in school.
Yes.
In school, he or she can face stress because parents can be stressful. Say, okay, we want you to be the first in the class. We want you to have, it's good to have good marks, but sometimes it can be stressful for them.
The kid.
And also in school, teachers can also say, okay, we want you to be, better than,
okay, I see. So that's the part of social.
So it's a social, it's psychological, and it's biological.
Yes.
And that is why if you see, for example, in biological, many chronic conditions are seen in the society. So if someone has a diagnosis of cancer, surely he can have depression.
Yes. It's very possible for
him
to
have depression.
Yes.
Yeah, social problems, so many.
Yes, and of
so
course
many
the family issues.
And family issues. So family issues also for development of children. That is why we can also see many people with personality disorders.
Yes, because of what they went through. Childhood.
Through development, childhood, and when they're adolescents.
Yes. Yes, thank you very much, Dr. Arthur Rukundo. Just reminding you that we are still discussing the essence of mental health awareness in fighting drug abuse. And our guest today is Dr. Arthur Rukundo. He's a psychiatrist since the year 2006, and he works at Ndera Neuropsychiatric Hospital. Rukundo, my next question is there any relation, now that we are discussing using mental health awareness in fighting drug abuse, is there any connection between mental health and drug abuse? Is there any connection?
Of course, yes.
If you can shed more light on that.
Of course, yes. Now I was talking about personality disorder.
Yes.
So most people who are using drugs or who are addicted to drugs have personality disorders. So in personality disorder, we have borderline personality.
Yes, which means?
Oh, I'm sorry, we can't. I don't think we can have time to explain personality disorders, personality disorders now. Perhaps we can choose another day.
Yes, maybe you can shed more light on each and every point, because some of us, we studied MEG, others studied HEG, others, like we are not familiar with these medical terms.
You know, in a borderline personalities, the main when you have a personality disorder, the main problem you have is adaptation. Adaptation, or the way you cope with stress, with problems.
Yes.
You know? So, and in borderline personality, they have also this problem of coping with stress, with peer pressure, and
life
challenges. Yes, and their mood is is changing,
up and down.
Yeah, up and down, and they have especially lack of affection.
Yes. Lack
of affection and attention. So there are people who are looking for affection, looking for attention, and it's normal. You know, we are human beings, and we have that need of being appreciated by others, of being loved by others, being having good interaction with others. And when someone is has a problem of attention, or feeling that he or she's not loved by people, it's not good.
Yes, it's not good.
It's not good, and it affects the emotions.
Yes.
You know.
Yes.
Yeah, and the second type of personality where we see use of drug is what we call antisocial. So the antisocial is a personality disorder where someone have experienced also lack of not only affection but also education.
Yes.
So when I say about education is that moment when you are with your parents and they tell you, okay, this is good, this is not good.
Yes, they teach you the right manners.
The right manners, yes. So imagine if you have not have that chance, let's call it a chance of having parents who are there to tell you this is good, this is not good. And you have to be respectful.
Yes.
You have to, there is laws. And you have to respect laws of the country, laws of the society.
Yes.
So imagine when you are someone who have not received those informations. You be there and you will function as the way what you want, you will do.
Yes. And you don't have boundaries.
No boundaries. So here, let me tell you about something which is very, very important and have to be understood by people, is that we are all human beings and we need pleasure.
Yes.
We are looking for pleasure. We are looking for good moments.
Yes.
And everything, every situation that can bring us
That
those
good
feelings,
mood,
that good
feeling,
feelings,
yes.
that pleasure, we
Go for it.
go for it.
Yes.
We are attracted.
Yes.
But that's where the part of education is good or act is that everything, everything that can brings you pleasure or good moment, you are not supposed to do it.
Yes.
You have to have control on it. So these people who have antisocial personality,
Yes.
what they want to do, they do,
Yes.
without any boundaries.
Boundaries.
Yeah, and that's the problem. Many
young people.
Who have that personality can do rape. Can rape many people, and without any remorse. That is where you can see that someone is abnormal.
Yes.
When he can do bad things like raping someone, raping a girl, and go without remorse, or kill someone without remorse,
Yeah.
or steal something without remorse.
Yeah.
Yeah.
Yeah. Yeah.
So drug abuse is in connection with mental health disorders. Drug abuse is in connection with mental health conditions, is connected with personality disorders.
Yes. One more question that one would ask is, now that we know that one person can be having a certain mental disorder and then go for drugs, thinking that's where they'll get refuge, and one would ask, what comes first? Do I first be mentally ill and then I go for drugs, or I go for drugs, then later experience mental illnesses? What comes
first?
Yes.
I can't say that one comes first. It's possible to be affected mentally and go for looking for drug, let's say, as a kind of medication.
Yes.
Let's say, for example, if you are depressed, you can face a situation, a worse situation, and be depressed,
Yes.
and have depression.
Yes.
Then you will start to use drugs, to use alcohol, to use other drugs as something which comes to reduce the pain you are feeling.
Yes.
You see. So at that moment, it is the mental problem that comes.
Give birth to
Yeah.
drug abuse.
Another condition is that you can, especially young people, you can be in a situation that your friends tell you, okay, if you want to be integrated in the group, you have to take what we take.
Yes, peer pressure.
Peer pressure. So then you can start, and progressively you will increase, let's say, the quantity of drugs and become
mentally
ill. Yes, presented what I've said, psychotic symptoms.
Yes.
Yeah.
Yes, I get you.
So it's possible. Both are possible.
Both
to
are
start
possible.
by drugs and become mentally ill.
Yes.
Or to start by a mental disorder and take drugs.
Yes.
Yeah.
Yes. Yes, that's very true.
And that is why, the prevalence of mental problem or drug abuse is very high.
Yes. Yes. Yes.
Because you have peer pressure. Peer pressure is there. You have chronic condition, physical condition.
Yes.
And you have also
Social.
mental health condition.
Yes.
So yeah.
That's why they are very common. And
many people are affected. Yeah.
Yes, yes. At Purpose Rwanda, we normally say for a purposeful and addiction-free Rwanda. And now that we've listed all the problems that are there, now we're going to see what can be done. If we are going to uproot this thing of drug abuse in our society, where should we begin from? Like, where should we begin if we are to deal with drug abuse?
That's a great question. It's a great question because, let's say we can start by sensitization. give information to parents,
Yes.
give information to young people, approach them, you know, and teach parents about what children need
Yes.
the most, you know, and teach them what children need at early stage of development.
Yes.
Because a child of 5 years old is not the same as a child who is 15 years old
Yes,
or 20.
very different.
The needs
Are
are different.
Yes.
Are different. So here it's about information.
Yes.
About informations and tell parents that their presence is very important.
Yes.
Very, very important, and they have to be close
to their children.
To their children. And tell also to young people to be free.
Yes.
To communicate to their parents.
Yes.
When they face problems, when they face pressure, when they face stress.
Yes.
Here I want to stress about communication. Communication is very important between parent and children, between children and parent. This kind of sensitization can be done at a local level.
Yes.
But also it can be done on TV.
Yes.
It can be done on radios.
Yes.
Because as I started to say, mental health, there is no health without mental health.
Yes, definitely.
So the society has the right to have information about mental health.
Yes.
And knows that mental health is the key part of health.
Yes.
Yeah, and knowing that, as I say, we are all human beings.
Yes.
We look for peace. We look for stability. We look for pleasure.
Yes. And
we don't want to face stress. We don't want to face pain. You know?
Yes.
And if someone is facing painful condition, we are there.
Yes.
The society is there. Doctors are there. We have structures.
Yes.
In the country. And let me say something about the stigma.
Yes.
You know, mental health problems are not as the same as, you know, internal problems, physical problems. It's easy for someone to have a physical condition and go to the doctor.
Yes.
To say, okay, doctor, I'm not okay. I'm feeling pain in my stomach. I'm feeling pain in my chest.
Yes.
But when it comes to mental health, there is that idea when if you go to see a psychologist or you go to see a psychiatrist, people will say that you are crazy.
Yes.
And you know, that is why many people are suffering. And they have that kind of shame of saying, if I go to see a psychiatrist, if I go to see a psychologist,
yes,
my friends
will say that I'm not mentally stable.
I'm not mentally stable. I'm crazy. I'm a fool. You know, and that is why, according to my experience, many people come to the hospital or to doctors and psychologists
yes,
after a long period of suffering.
Yes.
Yeah, so this is part of prevention, is information.
Yes, information.
Information of people and say, okay, if you are not good,
yes,
be free. It's not...
the end of the world.
Yeah, it's
yes,
not the end of the world. It's not weakness.
Yes.
It's not a weakness.
Yes.
It's you have to develop or to have courage of seeking help.
Yes.
The family is there, the society is there, and the doctors are there to help.
Yes, while we are still talking about the medical support, at Ndera Neuropsychiatric hospital or even other hospitals that deal with mental health issues, what support do you give to these people? Because there are people who are still who still undermine the role of medical assistance in solving mental health problems. What kind of support do you give to people who come to you telling you that I have this issue, I'm experiencing this, I'm experiencing this? What kind of support do you give them?
Okay, we give a great support, I can say.
Yes.
It's a great support because we are present, we are available.
Yes.
The hospital is there, and the main objective of the hospital, like Ndera Hospital, is to deal or to help people who are
Having this issue.
having these issues. And the kind of support is a medical support first. It's a medical support, understanding the problem of the patient.
Yes.
Be there and giving attention to them.
Yes.
And when it requires to give them medication, we give medication. That's the first part.
Yes.
It's the biological approach. We give medication.
Yes.
The second approach, it's a psychological approach. There are psychologists who are there to help the patient.
Yes.
And give them what we call psychotherapies,
Yes.
sessions of psychotherapies. And there is also a social support. Because remember, causes are biological, psychological, and social.
Yes.
So we have also a social approach that we give to patients and their families. And let me tell you that it's effective. When people come to seek for help, and when we apply these three approaches, it helps patient and families.
Yes.
And let's say that when a patient is affected, mental health disorders, the family also is affected.
Definitely.
That is why we have to help the patient and the family too.
The family as well. Yes, yes, yes. Thank you very much. Now, as we head to the conclusion of our today's show, where we have been discussing the essence of mental health awareness in preventing drug abuse, what are your recommendations as we head to the conclusion? What are the recommendations or the advice that you can give to the audience who've been following us since the start on having good mental health and, of course, preventing drug abuse? Because we've seen there is a connection between the two. What recommendation of advice, 3 or 4 or 5 or anything that you think can help people who've been following us to be mentally healthy and, of course, get rid of drug abuse? Yes.
Wow, that's also a good question.
Yes.
That's also a good question. The first advice is to recognize that mental health is the key of health.
Yes.
And people have to be aware of their mental condition.
Definitely.
Saying that, how am I mentally?
Yes.
Yes, physically it's easy to see yourself and say, okay, I'm good. I can walk, I can run.
Yes.
But when it comes on thoughts, my thoughts, how are my thoughts?
Yes.
Do I think normally?
Yes.
What about my emotions? What do I do to maintain a good state emotionally? What do I do to increase my knowledge about my health?
Yes.
Even about other
Issues of life.
other issues of life, And how is my behavior? Do I behave normally? Do I interact in a good way?
Yes.
Who am I in the society? What is my part? Who am I in my family? Who am I in the society? When I'm with my friends, what is the good example I'm showing?
Yes.
So it's something very, very crucial to stay alone and say, okay, am I good emotionally? Do I think normally?
Yes.
Do I act normally? And this is very, very important. We have talked about mental health We have talked about drug abuse. We have drugs around us. We can use or we can abuse. Why do we use?
Yes.
Why do we abuse? When we start to abuse, it means there is a problem.
Yes.
So when there is a problem, seek for help. When there is not a problem, prevention is better than cure.
Yes.
Be in control.
Yes.
You know that on bottles of beers, they say, okay, don't take if you are above.
Yes, you're not allowed
or
to
take responsibly.
Yes, responsibly, drink responsibly.
So when do we become responsible? That's a good question. Is it at 18 years old? Or 17 years, or 25 years old?
Yes.
So let me give you, for example, what I do personally to help the youth
Yes.
in mental health and drug abuse. I have a basketball team. And that basketball team, it is not only about basketball. It is about life.
Yes.
I teach them the social part of life. And you are called la vie. La vie, it's life.
Yes.
So I tell them the social, how to socialize.
Yes.
How to create teamwork.
Yes.
How to win as a team and how to lose as a team.
Yes.
And tell them that to lose or to win, it's part of the journey.
Definitely.
It is part of life.
Yes.
That's the first thing. The second thing in prevention, you know, these drugs or others behaviors, as I said, can bring to us pleasure. But as we can have the ability to choose, I teach them that they can use sport to feel
the
pleasure.
pleasure that they would otherwise seek.
Instead of using drugs.
Yes.
Okay? And other thing, I tell them it's that they have to work hard. They have to develop, you know,
Hardworking spirit.
hardworking spirit. They have to be punctual.
Yes.
If a player is not punctual on the playground, do you think he can be punctual in work? If he has a job, no.
No.
So that is what we teach them, to work, to be punctual, to be social, to develop teamwork, to rest.
Yes, resting is very
important.
Yeah, it's very important. Very important.
Resting is very important. And at the end, to have a vision in life.
Yes.
So if you have a vision in life, you can seek for support.
Yes.
You can seek for advices, and you can do your best.
Yes.
To be healthy. Thank you very much.
Yes, thank you very much, Dr. Arthur Rukundo. Maybe one more thing that I can add on what you've just said. If you're following us right now and you're facing a certain thing in life that you think is not that good and you think tomorrow will be the end of life, I just want to let you know that it's not over until it's over. The reason why you're still alive is because that certain thing that you're facing in life doesn't have the power to consume you alive. Yes. Otherwise, you wouldn't be existing. So that hope, I think, it's also key in fighting, in overcoming certain mental illnesses, like having hope in life and knowing that tomorrow, however much things may seem worse or not easy or difficult, just know that tomorrow may be a bright day and there is always light at the end of the tunnel. Thanks a lot for joining us, and thank you very much, Dr. Arthur Rukundo, for honoring our invitation. It has been a great pleasure hosting you and hearing from you as an expert in mental health. Thank you very much.
Thank you very much. It was also a pleasure for me.
Yes, and thank you everyone who's been following us from wherever you are at the moment. Just to remind you that in case you missed any of our previous episodes, you can find it on our YouTube channel, Purpose Rwanda. And as our motto says, it's for a purposeful and addiction-free Rwanda. Until next time, I am Lavi Mutanganchuro. Have a good night.